Hi, Dr. Saxena here, and as a kind of series which we are trying to talk about some medical terms and all that, and I certainly believe every one of you should you should know about what is this particular thing. I'll be talking on something on poor thyroid function. What is this thing called poor thyroid function? Well, see, what happens is we have been talking about this thyroid, and most of the time we believe we try to ask the patient, "You okay? You have symptoms of thyroid, and why don't you get this tested?" And by the time they come with the test and all that, everything appears normal. So, I just want you to understand what is this poor thyroid function, because this is not picked up very easily on lab testing. Because what happens is by the time you get into hypothyroid, there is a between normal and hypothyroid status, you have something in between which is called subclinical hypothyroidism. And this is one segment. See, if you have five people, one is hypothyroid, another one is a normal, you have got three people waiting for to enter into hypothyroidism. So this, on this basics assumption, and what we have seen clinically, because what are the cases, the people who with high cholesterol, the basic problem is subclinical hypothyroidism. So we need to understand what is that we are trying to you should know what are your symptoms. You got some cold feet, you got some dry skin or thinning hair, and or you have some unexplained weight gain, you have some constipation, or you have an intolerance to the cold. This may be the symptoms of hypothyroidism. And I'm talking about something like subclinical hypothyroidism. And what are the reasons for this particular thing? This is the most common thing which believe is some nowadays what I'm seeing these days are autoimmune disease, which is called Hashimoto's thyroiditis. But there are certain other things, factors such as diabetes, certain prescription drugs, which can lead into something like poor thyroid function. So we'll be talking about this poor thyroid function. There is something called radiation therapy which can cause you a poor thyroid function. Lack of iodine in your diet also can result into a thing. So iodine is the key for the thyroid health. We have been told about that, and we need to. This is one of the things which when we enter the medical college, we were told about these particular things, and this is more than 100 years ago. Iodine was shown to reverse and prevent goiter, and this was the kind of thing which was just giving that iodine was we are able to correct that hypothyroidism. Now we understand that we have got iodine. What are the reasons why we are talking about the have I broadly put across iodine as functions of iodine. There are four important iodine functions of iodine, and one of them is stabilization of metabolism and body weight is the one thing. It is responsible for metabolism of carbohydrates, proteins, and fats, and you need iodine for growth and development of brain and central nervous system. So this is one thing which has been told. And for fertility and ovulation in women, you need iodine. And your optimization of your immune system, iodine is a potent antibacterial, antiparasitic, antiviral, and anti-cancer agent. And you need to know this particular thing, then you can understand why this your doctor or anyone who is keen on supplementing iodine. So that is one thing which I always believe. There are some ways we try to improve your iodine in your body by working on that. So needless to say, if you are feeling sluggish, you are feeling fatigued and tired, and you have difficulty losing weight and have dry skin, hair loss, constipation, and cold sensitivity, you may be actually having something like iodine deficiency. So you need to work on that. There are good number of studies which have been done now, which shows there is a what is happening is there is a increase in rates of thyroid disease, there is increased rates of breast cancer, fibrocystic breast disease, prostate cancer, pregnancy related problems. All these things are on a high. So we believe iodine has got an important pivotal role in on all these above conditions, where we can just supplement the iodine and we can always reduce the incidence of these diseases. Yes, I mean in fibrocystic disease of breast, you have got uh, breast cancer, you have got mental retardation, you can always see that this particular things can come down, obesity, prostate cancer, just by supplementing iodine, which we can give a good kind of thing. So coming to a different area, what are the sources of iodine and all that? We have been talking about this for in the food section. We had enough so what what is happening here is, as a kind of working in a metal toxicology, trying to work in a environmental medicine, I can only tell you why these iodine levels are coming down. It is because your bromine levels, the funny this is iodine levels are falling in people who are vegans and vegetarian diets, because less iodine is used in the agriculture industry now. You take diets low in fish, and sea fish and all that. The people who are strictly vegetarians, they have low levels of iodine in the body. The another reason why there is iodine is getting down is because you have got something like toxic halides, and these halides are basically bromine, fluorine, and chlorine. And any amount of high levels of bromine, any amounts of high levels of fluorine or chlorine can cause that shift, decrease in iodine levels. That is one of the major causes. So if we encounter this bromine, fluorine, and chlorides in a lot of food, beverages, medications, and environment. So see, what happens is we keep telling, we need to understand here, bromide and fluoride are toxic, whereas chlorine as well as iodine is good. So what happens is that if you have got high levels of bromine intoxication or fluorine kind of thing, it occupies, they grab on the iodine receptors, blocking the action of iodine and thyroid hormones and contributing to that serious disorders. So this is one of the reasons why you are getting into bromides are a menace to your endocrine system and is present all over, and it's a serious concern because of its endocrine disrupting link to the cancer. And I can always tell you, this is the potassium bromide, which is added to the breads and baked goods, are a huge contributor to this bromide overload in our culture now. And we are getting some things like, there is something like brominated vegetable oil, which is derived from soya and corn, and is used as a stabilizer and emulsifier in many soft drinks and all. So this is the same bromine is found in the fire retardants used in carpets, uh, upholstery, mattresses, furniture, and some medical equipments. So this kind of thing, which I always tell, bromides are the most dangerous kind of things, because I had worked in some cases like ADHD, deficit hyperactive disorder, where there is a reason bromide is blamed, and it is one thing which is causing that particular, it's neurodevelopmental disorders and behavioral changes and all that. It is all linked to this particular thing. And you have people who has been to sodas and all that, and they have ended seeking for medical attention because of their skin lesions, memory loss, and nervous disorders. They are all symptoms of this bromine poisoning and resulting in iodine deficiency. So this, with this concept, I just want to tell you about something about fluoride. We know about, we have seen in our neighboring areas. In I live in Hyderabad, so I Nalgonda. We used to radiograph. When I was a radiologist, I used to see the fluorosis of the spine and all that. We have seen plenty of this particular stuff, and still the problem is still there. Fluoride is being still used in the toothpaste and all. It has to be we need to be careful about that. There is one more thing I would like to tell you about iodine deficiency. Really getting into hypothyroid, the commonest thing which I believe is this thing called perchlorate. Perchlorate is a naturally occurring and man-made chemical that is present in the bleach, fertilizers, rocket fuel, and explosives. It can be found in the drinking water, and perchlorates can disrupt the endocrine system, and they can disrupt the thyroid's ability to produce hormones for normal growth and development. So on this thing, we just want you to understand this, yes, the function of thyroid, what is the things which are making your thyroid poor, um, poor thyroid function. You need to look into that. Look into all these things, simple things, toxic halides, trying to look into perchlorates, trying to look into some medications. It can be a simple statin drug which you are reducing your cholesterol, that can lead into hypothyroidism. You need to be aware of all these things before you can always I always believe you need to see, we are talking about optimum health here. We are not talking about I don't want you to wait till your thyroid goes totally gets depleted and you become hypothyroid, then you look for answers. You need to be, you have to be proactive. You need to pick up when you have got these symptoms. There are 4 or 5 major symptoms. These symptoms are quite easy. If you feel sluggish, feel fatigued, tired all the time, have difficulty losing weight, have dry skin, hair loss, you have got constipation, and with cold sensitivity, you have problem with your sluggish thyroid, which is probably because of the iodine deficiency. Iodine deficiencies, again, we have discussed what are the possible reasons why iodine deficiencies occurring here. So, friends, this is one thing. This I try to cover few signs and symptoms of how to work it out, and possible solutions of how to keep your thyroid in a peak condition. Thank you.